Hello, I'm Microsoft MVP Tom Morgan. I usually try and keep a bit of a gap between the stuff I do blogging and the stuff I do work, but I thought this was quite an interesting topic I wanted to talk about. So I've asked Tom Scott, who also works at Modality Systems, which is where I work, to come and kind of just chat through with me about virtual consultations. So Tom, I know you've been looking after the sort of virtual consultation telehealth space that we have with Modality, and I think that's quite obviously a very interesting place to be over the last 6 months. I'm interested to know though what it was like before COVID. What's the appetite been for doing virtual consultations in places like healthcare and prior to where we are now?
Yeah, absolutely. Thanks, Tom. There's two distinct worlds within one consultation and within virtual consultations as well. That before the COVID restrictions were imposed on us, virtual consultations in telehealth and in healthcare were very much seen as an art of the possible and kind of evangelist idea, where it was a nice thing to do, but no one really had the time to commit to test them, move to them, and that was on both the patient and the professional, on the doctor side of it. But since March and since the social distancing and the working from home restrictions were imposed on us as part of the Covid-19 pandemic, those traditional blockers had gone, and it was now a necessity rather than something that was a nice to have. And at which point there was a real drive and appetite for it within the healthcare sector in particular.
That's interesting. Yeah, and what we have to try and guess and try and figure out, and I don't know what you think about this, but do you think virtual consultations in healthcare are a solution for right now because that's the only option, or do you think it's fostering a new way of working? Where do you see that going?
It's really hard to tell at the moment. Right at the start, I think it was very much seen as right at the start of the pandemic, I should say, it was very much seen as a sticking plaster, as a kind of, we need this now. We need something to quickly enable us to see our patients and maintain that continuity of service. The really interesting thing from the technology point of view is that as time has gone on, and as both patients and clinicians have seen the benefit of virtual consultations, then it's really becoming a lot more as something that people are going to offer following the pandemic restrictions. So as we go forward now, more and more trusts are seeing actually there are benefits to this that we don't want to lose, and I think they're all going to start to try and find some balance between what was traditionally face-to-face service and but also then being able to use the technology we have today to deliver consultations and see that and retain the benefits of that.
So it's interesting. So I'm like a developer, like I like the new shiny things. I like the technology march. And so I can kind of see how this all makes loads of sense. I know though that not everyone is like that. And people don't like being left behind. Lots of challenges get thrown up in the way of doing something like virtual consultations at scale, and security is like the biggie. But there's others as well. How much is that still a problem now? Like, does it take a global pandemic to actually reset expectations? Like, what about quality of service? What about all the things that got thrown up as roadblocks? Are they still there, do you think, or are they mushier than they were?
I think you still have to do them well to make a good service. The difference is that they're not being put up as blockers as a reason not to do it. They've almost become expectations of a service. That what's changed is that rather than people using all of the things that you've just mentioned as a reason not to do virtual consultations, they know they need to do them now. They want to do them. Those things have now just become expected as part of a service. If you're going to do a good consultation service, you need to have all those as part of it. And they just become, it's just those customer expectations of the technology and particularly the service have also increased along with the demand for it.
Yeah. And I guess it's been something of a journey the last 6 months. I wondered if you could kind of highlight what we've seen at Modality in terms of like how one consultation has changed in terms of usage and like uptake and numbers, and yeah, because obviously it's been a busy time, but yeah.
Yeah, absolutely. It's been the demand for it and the usage of it has increased massively since March. I think before March we had 2 customers using one consultation, and it was really within a very limited scope within those NHS trusts. It was particular teams were using it, and they were on a good month doing maybe 200 consultations a month, and in a pre-COVID world, we all thought that was great that we had 200 consultations across a service. You know, isn't this adopting well? And I think now in the post-COVID world, that same NHS trust that we're working with have just ticked over 1 million consultation minutes that they have done since the 1st of March. So the scale of it has gone massively through the roof, really, in terms of what we've seen people using it, customers, services, and then also the actual number of consultations being used.
And does that mean that the technology is ready and the people can be made to be ready, or do you think there's still work to be done on both of those camps?
I think that there's always going to be work to be done with them to keep meeting people's demands for it. What we've seen is that the demand is there from patients very much for this service, that patients want this flexibility, that they've got this technology that we all use every day since the COVID world in particular. The idea of Zoom meetings has become, you know, that's how you see your friends. You did a Zoom meeting during lockdown. There were virtual quizzes. People found all kinds of, I heard of virtual stag do's as well, all kinds of things using video conferencing for it. So that expectation is there, and people are very much ready for this. The technology is ready as well, but what we need to keep doing as technologists and people delivering the service is keep evolving to meet the demands of the patients that are using it, so that we as they use it more, they become more comfortable with it, they expect more of it, and we're there to be able to meet it.
And what happens, I guess, as hopefully we slowly unlock and sort of we get back to something like normal in the next couple of years, whatever it looks like, do you think there'll be an attempt to go back to the old way of working first, or like is it a new hybrid model? Or do we just stay where we are? And you know, there's advantages to doing it virtually. So is that where we're going to end up? Like it's impossible to predict the future, but like what do you see from where you are?
From the conversations I've had with people, they very much don't want to go, and sorry, by people I mean the conversations I've had with the NHS trusts and the teams in those trusts delivering the service, they very much don't want to go back to the way of working fully that they were before. That so many people have seen the benefits of this technology. They want to they want to be able to continue using it and continue realizing it as well, because it helps.
That's really interesting. From like I say, as like a techie person, my initial thought would be, yeah, these users just want to go back to what they had before because that's what they're used to, you know. And then, you know, they're only doing this tech stuff because they have to, sort of thing. But no, you're saying it's really changed perception, and yeah.
I think so. I think for the first couple of months, you'd be absolutely right that everybody was like, oh, it's the short, when we thought the lockdown was going to be 6 weeks, 8 weeks, you think, right, okay, I'll adopt this, I've got to get through it. But I think as time's gone on and we've realized that, you know what, nothing's really going back to the way it was before anytime soon, people's perceptions have changed in line with that. So I think the key challenge that all the customers we've got is trying to find a balance between some of the face-to-face services, because as you know and I know that you can't do everything through video. It's still good to go and see other humans at some point, but it's trying to make sure that that interaction is kept to the right services, and that the video technology like this is also used in the appropriate way as well, so that for as an example, simple easy, just general checkups, where there's not really a need to do it face to face, are perfect for virtual consultations. But if it was something like a physical exam where you need to be in person with that, obviously it's a lot harder to do over a video consultation. So it's a horses for courses thing. They're trying to find a balance, but the general consensus is there's an appetite not to solely go back to everything face to face. It's trying to find more of a balance. I think they call it a blended service they're trying to deliver.
Right. Yeah, that makes sense. Oh, that's really interesting. No, thank you for your thoughts. I think that's kind of really interesting to compare like what you're seeing, what you've seen over the last 6 months. I think it'd be really interesting to see what the next 6 months bring, as we're sort of driven by the conditions, and to see how that goes. So maybe come back in 6 months and we'll see where we land. But thanks very much.
Yeah. No, thank you for having me. Thanks.